To Consumers Doctors Channel on behalf of Foremost Organization. Lately, I haven't been streaming much on healthcare, but after a couple of weeks of break, so I'm back live talking about back on healthcare, the topics. Today's topic is why is healthcare expensive in the United States? Everybody had asked the same question. Why is it healthcare is so expensive in the United States? I'll go through a few items, folks. I would like you guys to listen and give your opinion because healthcare has been a contentious issue for both Democrats and Republicans. During Obama's presidency, the debates over Affordable Care Act, both parties touted healthcare as a market. Yes, the Republicans arguing it will limit consumers' choice. Affordable Care Act ultimately arguing that the law puts consumers back in charge of their health care. But this presumption that healthcare is a market and we are in charge is a fallacy, is a hoax. If it truly were a market, consumers could shop around for best healthcare, comparing safety rankings, overall value of healthcare they need. However, healthcare industry notoriously shields fees not only from the competitors but also from us, the consumers. Yes, it shields from the consumers. For instance, in Washington, D.C., one hospital charges $115,000 for putting a patient on a ventilator. Yes. While another hospital charged $53,000 for the same service. Same service. While ultimately insurance companies, even the uninsured, can negotiate the rates, knowing the cost of procedures which hospitals provided the best outcomes. A critical information with which we as consumers are not provided. Yet, majority of the healthcare providers can't actually tell us the cost, even if they want to, even if they wanted to. Consumers has to know where to go to get this information. They have to have it. They should be able to find that information, what they cost. According to the Organization of Economic Cooperation and Development, OECD, we pay more of our taxes as a share of the GDP than many other countries that have universal care, healthcare. More than Switzerland, Canada, United Kingdom, Australia, Norway, among others. Government-sponsored insurance like Medicare, Medicaid, TRICARE are paid for your taxes. Yes. In addition, we pay exponentially more in our own money for private insurance than any other country in the world. The overall cost of healthcare in the United States exponentially higher than any other so-called developed country. Any other developed country. The quality of USA health care ranks the last among the 11 richest countries, folks. 11 richest countries. We are not getting better quality of care despite the expense. We all know that. A major indicator of quality of healthcare. United States has the highest maternal mortality rate among the high-income countries. And the rate in Texas recently doubled. Of course, some of our providers' capacity innovation is truly enviable, yes. But overall, we are not better. We are not better off despite the costs. It is so expensive, has everything to do with fat profits for healthcare industry from pharmaceutical companies whose profits rival big banks. Can you imagine that? Pharmaceutical companies' profits rival big banks. To the massive hospital conglomerates and physicians groups charging whatever they want to in the absence of government regulation. In the absence of government regulation. When pharmaceutical companies charge egregious prices for life-saving drugs, we deplore the companies rather than pointing fingers at a government that allows companies free license to make our health into a commodity. Health into a commodity, no matter the cost. Why wouldn't the government allow it? Well, some members of Congress have stakes in healthcare industry, folks. So they are profiting too. They are profiting too. Congress, both Democrats and Republicans, represents the corporate interests. Yes, they represent the corporate interests more than very citizens they elected them. Yes. The wealthiest 10% of the Americans have more influence over what passes in Congress than rest of us. Can you imagine that? Meanwhile, 95% of all organizations lobbying in the government represents the interests of big companies, big corporations. Represent compared to 5% representing the public interests or labor unions like this channel. 5%, folks, 5% represent the public interest, consumers' interests. Healthcare is so expensive in the United States because lobbyists within the healthcare industry ensure government doesn't regulate the industry. See, government doesn't regulate the industry. While the cost of drugs is skyrocketing, we deplore the cost of insurance. Even if you have a private insurance, your taxpayer dollars are paying for of skyrocketing, skyrocketing prices of necessary pharmaceutical, which cost all of us more. There was a proposal of a voucher system for Medicare. There was a proposal of a voucher system in Medicare. Paul Ryan tried to curb the egregious government spending, but cutting benefits to citizens means they will shoulder the burden while corporations continue to make record profits at the expense of all of us, all of us. While Affordable Care Act has its merits, one of the main reasons it even passed was because it never threatened to control the healthcare costs. That's the only reason it passed, because it never tried to address the controlling the healthcare costs. Paul Ryan's idea about vouchers and cuts will do nothing to curb the costs either. Yes, it is up to us. It's all up to us to lobby the government and tell our members of Congress that profits before patients is completely unacceptable. Profits before patients. Folks, time has come. Time has come. We all have to. We all have to go after the Congress to put the public interest before the profits by these big conglomerates. Instead of serving the public, they're profiting. Pharmaceuticals, insurance companies, hospitals, healthcare professionals, all profiting at the expense of you. I would like to see everybody embrace deductible health plans where you can lower your premiums, which could be more affordable, and put money aside into the health savings accounts. That will give, that will empower you by having health. You know, ultimately the goal is to provide the best care for the people who can't afford it. That's the goal. People who can't afford the health care. They should have the same access to like anybody else. We need to focus on people who are physically disabled, economically impaired. Those are the folks that need the best care. Giving this Medicaid, Medi-Cal card is not going to be acceptable. We need more than that. I think instead of putting the money in the pockets of the insurers, they should put money into the pockets of the Americans where they can shop for the health care, the best health care. Medicare wastes so much money on the insurers, insurance companies. They would rather invest in insurance companies than you. That same $1,200, $1,300 every month, Health and Human Services pumps into the insurance companies. They can give the same money to the seniors. They can shop for the best health care and they can put money aside into the health savings account. One more thing, if you're a senior, you can't contribute to the health savings. I don't know where that came from. If you're a senior, you cannot contribute to the health savings. That's such a ridiculous idea. If somebody gives me $1,200, if the Medicare gives me $1,200, I should be able to put money aside into my health savings account. We need to radically think different, change the direction of the healthcare where consumers can shop for the healthcare. Premiums, healthcare services, hospitals, all the amenities. Folks, thank you for listening. Thank you for joining the healthcare. We will see you in the next episode of Consumers Doctors channel on the behalf of Foremost Organization. Thank you. extremely much on healthcare, but after a couple of weeks of break, so I'm back live talking about back on healthcare, the topics. Today's topic is why is healthcare expensive in the United States? Everybody had asked the same question. Why is healthcare is so expensive in the United States? I'll go through a few items first. I'd like you guys to listen and give your opinion because healthcare has been a contentious issue for both Democrats and Republicans. During Obama's presidency, defer, the debates over Affordable Care Act, both parties touted healthcare as a market. Yes. The Republicans arguing it will limit consumers' choice. Affordable Care Act ultimately arguing that the law puts consumers back in charge of their health care. But this presumption that healthcare is a market and we are in charge is a fallacy, is a hoax. If it truly were a market, consumers could shop around for best healthcare, comparing safety rankings, overall value of healthcare they need. However, healthcare industry notoriously shields fees not only from the competitors, but also from us, the consumers. Yes, it shields from the consumers. For instance, in Washington, D.C., one hospital charges $115,000 for putting a patient on a ventilator.
The topic today is an interesting
While
topic
another
which
hospital
I've
charged
never
$53,000 for the same service.
given the information how how my day
While
starts.
ultimately
This is
insurance companies,
fundamental.
even the uninsured, could
This is
negotiate
somewhat
rates,
unconventional.
knowing the
Somewhat
cost of
unconventional.
procedures, which
So
hospital
why do I
provide,
say that? I'll tell you why. There are some of the things
which
you
hospitals
know
providing
when
the
you get into this
best
space. What is
outcomes.
it ideal
The
for
critical
your day,
information with which
especially
we
morning
as
routine?
consumers, we as
Let me tell
consumers
you.
are simply are not
My
provided.
morning routine starts at
Yet, majority of the
5
healthcare
a.m.
providers
flight.
don't actually tell us the
I
cost,
usually have 6 to
even if they want to,
7 hours of sleep,
even if they wanted to.
but the day begins as
Consumers
soon as I get
has
up.
to know where to go to get this information. They have to have it.
Routinely, I
They should be
go
able to find that
and plug
information
my
without cost.
the the so-called uh,
According to the Organization of Economic Cooperation and Development, OECD, we pay more of our taxes as a share of the GDP than many other countries that have universal care, healthcare. More than Switzerland, Canada, United Kingdom, Australia, Norway, among others. Government sponsored insurance like Medicare, Medicaid, TRICARE are paid for for your taxes. Yes. In addition, we pay exponentially more in our own money for private insurance than any other country in the world. The overall cost of healthcare in the United States exponentially higher than any other so-called developed country. any other developed country. The quality of USA health care ranks the last among the 11 richest countries, folks. 11 richest countries. We are not getting better quality of care despite the expense. We all know that. A major indicator of the quality of healthcare. United States has the highest maternal mortality rate among the high-income countries. And the rate in Texas recently doubled. Of course, some of our providers' capacity and innovation is truly enviable, yes. But overall, we are not better. We are not better off despite the costs. It is so expensive, has everything to